Hello everyone, I hope you all are doing great. I am also doing well here. I'm back again with another video, which is basically, I know all of you are like smart, but this is again from my personal experience, because one of the friend reached out to me regarding her family, or I think near one's PPCM condition. So I thought, let's make everyone aware about it, whoever is planning to get pregnant, or who is already in pregnancy or post pregnancy, and the condition which I have been through, which is called PPCM. You guys must be aware about what kind of heart condition it is. So I'll quickly try to explain you what is PPCM, what are the causes and symptom, what kind of medications doctor prescribed me. So basically, let's start with this. When I got to know I had PPCM, or when I got pregnant, I was before that I was completely normal person. I never got detected for a high blood pressure, low blood pressure, or whatever the other heart conditions. Okay, I was completely normal person. So let's start with what is PPCM. PPCM is a peripartum cardiomyopathy, or also called as a postpartum cardiomyopathy. So basically, it's a heart condition in simple words for you, not going so too deep in medical terms. It is a condition, a heart condition, in which your heart gets weakened over the period of time. This is not something comes up sudden. This is it happens slowly, and the time reaches where your heart gets weakened. So I was suffering from this 7 years back, almost I think 2016. It was detected. So in my case, I'll quickly give you insight. I was detected quite late because of confused symptom of pregnancy and PPCM. So make sure the symptoms of pregnancy and PPCM, peripartum cardiomyopathy, are really similar. They are they might get confused, and that's what happened in my case, because the symptoms are very very similar. Doctor, even the very well known doctors missed it. And I got detected in the late pregnancy, when I was about to deliver the baby. Although I came out of it safe and sound, but it was really a nightmare. Those 3-4 years were literally so troublesome. And also I still have the effect or remains of that disease. So I was suffering from tachycardia from early pregnancy. Suddenly, in the first month of pregnancy, my heart rate was racing to 150. The normal heart rate usually is 70 to 80, but mine was 150 and up. It was quite abnormal, but the doctors did lot of other tests, but they never thought about this condition. Okay, so possibly because of no causes, or they didn't find anything, any background I might have for this disease. But I think if they are missing it, I think now you are watching this video, so you have to have the knowledge. Okay, this might happen if you're getting such symptom. In my case, I'll quickly go through the symptoms I was having. I was having tachycardia, which is high heart rate. Normal person, the heart rate is 70 to 80. Mine was 150 and up sometime, as I was walking, doing activities during pregnancy. Okay, this was the only symptom I had. I didn't have breathlessness. I was quite getting exhausted. But in late pregnancy, this is very common. Even I have been told that high heart rate is one of the symptom of pregnancy. So I was taking it like that. But apart from tachycardia or high heart rate, there are few other symptoms you might notice, like high blood pressure, like breathlessness, dizziness, swelling at ankle, and the joints. There is joints and all, right? So these are the some of the symptoms. Also, you will get more details on the Google. I don't want to mention each and everything out of it right now, because it lengthens my video. Yeah, so those were the symptoms, and very common symptoms I already told you. Now let's talk about the next what causes this. So basically, I'll talk about more prominent or most repetitive kind of causes to make your heart weaken. One of it is taking caffeine, like a lot of caffeine, like you're drinking coffee, tea throughout the day. It definitely causes your heart weakens. It might cause, I mean, not definitely, it might cause your heart weak. to become weak, and that was not in my case. They were repetitively asking me this question, how much is your caffeine intake. Another one is alcohol, drugs. It also can cause whatever is spiking your energy or spiking your heart rate. Its possibilities are there. It affects your heart as well. Another thing is heredity, or it came from your family. So my mom was completely normal. Yes, they have a high blood pressure. In my case, only heart was racing. My blood pressure was completely normal. No high blood pressure at all other vitals were really in good condition. In some cases they ask for obesity. In my case, I was overweight but not obese. I was not too high in too much weighing. So I think that was not in my case. But yeah, this is one of the cause as well. Then another one is preeclampsia. Like if you have preeclamptic condition, like you during pregnancy, some of the mothers get high blood pressure, then swelling in the joints like ankle and all, vomiting, right? So if you are preeclamptic, there are chances you might get the PPCM. So this is one of the cause again. And stress, of course. So I think stress is really important to be noticed. I think, yeah, that might be the cause, that have that caused me that caused me to get this PPCM, but it was unnoticed by most of the doctors I met here. So I think that needs to be calculated as well. And I would say the sleep is really important. I will talk about this in the next part when we will discuss about the heart attack. So I think these are the most common causes for PPCM to happen, because when I got to know I am having PPCM, I was trying to research whole out of the world, like 10 pages on Google. But also because of my background in medical, I was pretty aware about the heart conditions. So, and I consulted few of my friends, family, lot of other doctors from India, second opinions. I did out of the world research and second opinions. All the pathies I applied. So yeah, so these are the symptoms. And then we talked about symptoms, we talked about causes. Let's talk about the medication. So when they detected, basically they detected through the 2D echo. Let's talk about the diagnostics they did. They did 2D echo, they did EKG, or they called it EKG here. Mostly in developing countries, it's ECG. So from there they got to know, okay, I have heart tachycardia, but yeah, when they scanned my heart, they got to know my LVEF, left ventricle ejection fraction, was nearly 28 to 30%, which is abnormal. Most commonly, it's nearly 60 and up in a normal person. Mine was 28 to 30. That is what your heart is not pumping enough blood out, right? So yeah, then they confirmed, it was 4 days before my delivery date, that okay, you have a PPCM and you need to get admitted and deliver the baby right now. So these are the scans or the diagnostics they do. They do multiple other tests as well to understand your the blood panel. But mostly they start the medications after that. They tried lot of other medications, so I'll tell you. So when they detected I have a PPCM through 2D echo, what they did, they tried to give me the medications which applies for PPCM. Most commonly they prescribe beta blockers. So there are multiple kind of beta blockers, I think. But in this condition, mostly people get tachycardia with high blood pressure, high heart rate and high blood pressure. But in my case, only and only symptom was tachycardia. It was really difficult to handle the blood pressure, because what was happening, when they were providing me beta blocker which lowers the heart rate, it was also lowering my blood pressure. But in my case, the blood pressure was already normal. So, and there were no such medicines which can help both of them stay together, and which does not affect the blood pressure but lowers your heart rate. So for once they tried one of such medication, I think metoprolol only, I don't know which was that. It was a different version or some of metoprolol. I don't remember what was it. But yeah, they tried, and suddenly my heart rate dropped and I passed out. My baby was in tummy, and she also dropped her heart rate, and I thought like it was my last day. Everything was blacked out. So the medication actually went wrong and it didn't help me. Then they suddenly gave me emergency care medicines. I retrieved back. So basically, it was about to be my last day, but yeah, I came back to life. Then this was the medicine they tried, but after that they found out another beta blocker, which usually doesn't affect that much of your blood pressure, but they gave me the minimum dose. But still I have been monitored in ICU for 15 days. My daughter was completely normal, but sometime it happens like baby might get some similar kind of situation if your heart is not pumping well, right? But she was all right, she was completely well. So yeah, after that they started minimum dose of metoprolol, but monitored me a lot. They gave me portable defibrillator, जो shock देने की machine होती है, and I was wearing it at home because they were not ready to relieve me from the hospital, because the mortality rate in this situation is around 18 to 56% in initially 1 year post pregnancy. So they didn't want to take like any risk even though I was on medication. They strictly asked me to wear this, and also it was monitoring my heart rate, and if my heart rate is racing around 150 and above, it was just beeping. And that portable defibrillator gives you shock, just for like you watch in the movies and all, right? So it gives you shock at home basically, and I have to just push the button to stop that the siren or whatever what you call the noises coming out of that. Yeah, so it was a difficult condition, but fortunately after 2 years of struggling, juggling here and there, going around, I got to know after so many scans, I got to know my LVF has recovered around 60 to 65%. And then slowly doctor took out the medicine because I was getting dizzy and my blood pressure was completely normal, right? So then they stopped the medication, and right now I'm just taking alternative medicine constantly, because still my heart rate is above 100. Even though I do workout, I keep in mind that I have to I need to know my limitations. So basically I do the lifting and all, right? So a lot of people might think, okay, why is she doesn't have that good physique, why should we listen to her, right? So basically I'm not showing that I'm the perfect whatever the athlete figure or something like that. But with this condition, with having tachycardia or any of the heart condition, you need to know where to stop, what is your limitation, and how you need to manage your lifestyle, right? It's really difficult. I think at my place, any person might give up and they can just stop doing the normal activities, because I was scared hell out of the world. I was on the bed just laying around for almost 2 years because of the fear that I'm gonna die. So I think that's the most important thing. I want to convey the message to the society, even if doctors will say this is the last day of yours, only God can decide which one is your last day. So you need to think that few things you have to change in your life. And I started less stressing out, and definitely the sleep is also really important. Earlier I had sleep disorder for almost 10 years, and I think that might have caused this situation. I started stress is always there in everyone's life, but try to minimize it and go ahead with the life is like that. So let's talk about heart attack and what might have caused that to Sushmita Sen. So basically heart attack is the blockage of the blood flow to the heart muscle, which causes pain in chest, tightness, and after scanning or doing some vitals, you get to know from the doctors you are suffering from the heart attacks. The same condition happened to Sushmita Sen recently. So a lot of people were talking she was smoking, what is need to be fit, if we might get the heart attack and all, right? What's the need of going to gym? We should not go to the gym, it might cause the heart attack. So basically in front of you, a real example of PPCM is here. Even though heart attack is different, but in my condition, um, again, like, it was affecting the heart, right? So the causes are mostly same for, like, a lot of heart diseases. So in case of coronary artery blockage, the first and foremost factor we are missing, like, is like monitoring our heart. Even I miss that. Like, we from developing countries, people are not really getting their heart monitored. Up from 20s up to 50 and above, like, we need to start getting monitor our heart. At least I think we should do the basic blood work for heart, like the cholesterol, and of course the thyroid conditions as well. Sometimes they affect too, but uh, the cholesterol is basic. But if you already have the blockage, cholesterol not going to detect it. So I guess you need to go for a scan if you have family history of heart attacks or a high blood pressure or so I think you need to go get your heart scanned by 2D echo. She also mentioned that she missed it last 6 months, and now if you'll tell me that I have done my heart scan 1 year back, so that doesn't make any sense. Every year you need to get your heart checked, okay? I'm not saying 2D echo again and again, but there are a lot of other tests which you can do and get to know, okay, how well is your heart going. So basically the main factor, I would say, if you have like family history of, like, such conditions, heart attack, high blood pressure, low blood pressure, please get your heart monitored. It's really important. Anything can happen at any age, okay? Don't think about she is actress, he is actor. Nothing gonna be applied to your case. Now in case of Sushmita Sen, even though she was very fit, she was like, eating a balanced diet, looking happy always, what might have caused? So I think we are missing something here. In old days, like, our forefathers, grandfathers, just imagine, compare our life with them. They used to have very simple kind of satisfactory life. In our case, we have stressful life. A lot of stress is here. In my case also, I was stressing a lot. And I think, like, behind this actor and actress's life, we really don't enter. We just know from outside what they're doing. And here the gymming or the fitness pattern didn't really affect her. I think the stress or the sleep pattern, probably she's not getting the enough sleep. Third, she didn't monitor her heart, and she has a family history of it, okay? So if the chances are there, you might get it because your family has similar kind of body pattern, or their body functioning is like, definitely it comes from DNA, right? Our body is made from our DNAs, right? So definitely I think we need to get it checked, and that might have caused her. But again, the causes are different. Like a high cholesterol, high blood pressure, then the history of getting the arteries blocked and all those, like, because of high cholesterol, or maybe she had earlier had something but she didn't notice. A lot of other factors might be there, but I think we need to think about it, like, that how frequently we are monitoring our body, right? So I think even I missed that, and she also mentioned in her one of the videos that she missed to get her monitored, like, her heart recently. So I think every year you need to repeat your body functioning test, so then only you get to know. Because last year I was fit, that doesn't mean this year also I'm gonna be fit. Your body is changing, your age is changing, you're going, like, everything is changing, right? So how can you believe, like, 10 years back you did like that test, you didn't get detected for anything, but 10 year now you are detected with this. So you need to think like that, like, every year just repeat those tests, get it monitored, and you will definitely catch, like, if there are any pre-existing or about to get the conditions, you can definitely prevent it. So I think that's the most frequent cause about those actresses getting suffered from the heart attack, because very few people are getting their heart monitored. And body is there, so definitely the condition is gonna happen. Human body है, तो कभी ना कभी बिगड़ना ही है, right? So I think that's all from my end. The video was quite long, but I hope it will help you guys. Thank you so much. I'll be back again. Bye bye.